guys, my name is Tammy and I'm a doctor of physical therapy. In this video, we are going to be talking about lower back pain that is caused because of spinal instability. So this is basically when we have weakness in our core muscles. Those are the muscles that sit right here and then they go and they wrap around our spine like a belt. As always, before you go any further, make sure to read the indications, contraindications, and red flags. And don't forget to subscribe to our channel. So I decided that for this video I'm going to go over the exercises first, and then at the end I will go over who would benefit from these exercises and how to know if this is actually what you need to be doing. Again, I will put the minutes in the description for you guys, but if you have a type of pain that is like a shoot sharp pain going down your leg, if you have any numbness, tingling, weakness in your leg, please start from video 1 of lower back pain and then try to figure out if any of those movements help you, those exercises help you, and if they don't, you are probably going to land back into this video. So what I'm going to do in this video is start with the super simple but essential core exercises. Again, I will leave links to all the videos you can do to progress your core strengthening in the description for you, as well as the videos for the other lower back pain issues. So take a look and make sure to refer to them later on. It's easier to do these exercises on the mat as opposed to your bed because you want to make sure that you are on a firm surface, okay? The first exercise we're going to do together is called the Kegel exercise. Basically, we are trying to activate our pelvic floor muscles, okay? Now, these muscles are super deep in our body, and it's not like you can like flex your bicep and feel the bicep flexing. With these ones, we can't really feel them. So we are going to use our finger in order to feel that contraction of the muscle. So I want you to take one hand, put it right on that hip bone. So I'm going to turn to kind of show you guys. I'm going to palpate for that hip bone. Then I'm going to go 2 inches in, 2 inches down. Okay, so again, from that hip bone, 2 inches in, 2 inches down. So this finger is going to stay right here. And I'm going to make sure that I'm actually pressing pretty deep. But again, you guys, this is only to palpate. It's only to feel for the contraction, okay? This is not the exercise itself. And make sure that you're in this position. So your feet are bent, they're hip width apart, knees are hip width apart. Take one hand, the other hand, and put it right on your belly. So the goal is to try to be able to get a contraction where this finger is without really feeling a contraction in your belly. So your belly's super relaxed and you're able to breathe as you're doing this. Now, I want you to try to squeeze the lowest part of your ab. So the cue for females is that it's like you're trying to squeeze your pee. You're trying to prevent urinating, okay? But your bum is relaxed, your belly's relaxed. All you're doing is really squeezing the deepest part of your core. Almost you're trying to push your lower abdomen in and up, okay? And for guys, it almost feels like you're going into like a pool or a lake that's really cold and you feel like your abdomen is moving up. That's what it feels like, okay? Again, you can only really feel it with your 2 fingers. The other hand is right on my belly. I'm going to squeeze 1, 2, 3, 4, 5, and relax. Now, if you can get that contraction, great. I want you to repeat this for about, maybe start with 30, then 40, then get to 100, holding 5 seconds per day. I know that sounds ridiculous, but you guys, you really have to do that. And you might feel that maybe the first rep you do, it's super easy, you get the contraction. As time goes on, it gets harder. You might not really feel the muscle contracting, and that's because the muscle's still weak. This is the easiest posture to start this exercise in. Later on, you can move on to doing it in sitting and standing, then you're stuck in traffic. With COVID, we're not really driving, but let's say you were driving, you can do it while you're stuck in traffic, so you get your Kegels done. Now, if you're not able to feel the contraction, I'm going to close your eyes, start breathing slowly, and imagine that you're contracting it. Eventually, the contraction will come, okay? Now, The second exercise we are going to jump into is a posterior pelvic tilt. Now again, you guys, these movements are super tiny, so be patient with them. Again, my glutes are relaxed. All I'm doing is, if you take both hands, you put it on your pelvis, you want to rotate your pelvis downwards. So my hands are here, I'm going to go down. 1, 2, 3, 4, 5, and relax. Again, down. 1, 2, 3, 4, 5, and relax. If you guys pay attention, I'm not doing a bridge. I'm not bringing my bum up. I'm just tilting my pelvis in. Okay? Holding it for 5 seconds and relaxing. Now you can incorporate your Kegels with this exercise. So you do them both at the same time if you want. So have your fingers right where I told you, from that bone, 2 inches in, 2 inches down, squeeze and tilt. 1, 2, 3, 4, and 5, and relax. Now for your posterior pelvic tilts, you can keep it at 3 sets of 10. You don't need to do 100 of them. Now the next exercise we are going to do together is a belly roll. I know it kind of sounds strange, but I want you to take your hand, you're going to put it right on your belly. Now imagine that this is like a clock. Okay, so that circle that you made with your hand works like a clock. So you have 12, 3, 6, 9, and 12 again, okay? You're going to put your hand on your belly and you're going to try to move clockwise. So I'm going to first bring my belly down where 12 o'clock is, but everywhere else is relaxed. Then I'm going to go to 3 o'clock, then 6 o'clock, then 9 o'clock, 12 o'clock. So as I'm doing this, I am rolling my lower back, right? It's almost like I'm doing a belly dancing, and my back goes to the mat on one side, then up, then the other side, then back down. I'm going to show you guys this in a sitting position so you kind of can see my movement. I'm moving my belly in, then to this side, then down, then to this side. So I'm exaggerating it a little bit, but it looks like you're doing like a belly roll, like a belly dancing. So by the end of this, we'll all be belly dancers. I know it sounds complicated, you guys, but I want you to close your eyes, try to do 10 clockwise, 10 counterclockwise, and sometimes you'll see maybe on your right side, you can definitely feel that contraction and you feel your lower back pinning to the floor as you're doing this, but on the other side you might be not having that smooth movement. You might not be able to do a smooth cycle. You might have like aberrations, like jumping movements, right? And that's okay. It will come with time. Now, the next exercise we are going to do together is the bridge, because again, remember that our hips are helping our lower back. So if your glutes are strong, you are going to be strengthening your lower back, and it's great for us, okay? So the simplest glute exercise is a bridge. Again, I'm keeping my feet closer to my bum. Squeeze your shoulder blades back. Now, with this one, we are going to incorporate our Kegels, our posterior pelvic tilt, and then do our bridge. So take your hands, find that bone, 2 inches in, 2 inches down, squeeze so I can feel that with my fingers. But I'm still breathing, right? So I'm not tucking my tummy in, my tummy's relaxed. And then you're going to do your posterior pelvic tilt, so push your back into the mat. From here, squeeze your bum and come up, hold it for 5 seconds. And go back down. Now make sure your knees are not going out, they're not going in, they're exactly hip width apart. Again, squeeze, do the Kegels, do your posterior pelvic tilt, lift up, squeeze your bum, and back down. Again, you guys, with these, you are going to be doing 3 sets of 10. The next exercise we are going to do together is going to be helping us understand where the rest of our core is sitting. Okay, so it's a full core strengthening exercise. You are going to go into a quadruped position, that's like on knees and hands. You make sure your hands are right underneath your shoulders, your knees right underneath your hips. Now from there, what I want you to do is imagine that your belly is like an elevator, okay? So let's say we have 4 floors. Level 1 is your belly's fully relaxed, or 0 is relaxed, then 1 You bring your belly up a little bit, then 2 a little bit higher, then 3 a little bit higher, then 4 is all the way on top. So if I'm here, I put my hand on my belly, I'm having my belly fully relaxed, I'm on level 0, then I'm going to bring it up just a little bit, then level 3, then 4 is all the way up. Then from 4, let's go to 3, let's go to 2, 1, and all the way down. But even I made a mistake right now, tilting my lower back. So my lower back is going to stay neutral. So if I'm here, I'm going to arch my back a couple of times. Then I'm going to keep my belly right in the middle. Then from there, relax your belly. From 0, let's go to 1. Then squeeze up a little more. You're level 2. Then level 3. Level 4 is I almost can't breathe anymore because I'm really contracting my core. Then from 4, let's go to 3, 2, 1, 0, let it go. Okay, so again, these are all very challenging exercises. They're super small, super tiny movements, but they can be pretty hard if you're doing them correctly and you're being patient with them. Okay guys, the next exercise we are going to do in this position is going to be again an exercise that's going to help us activate our core muscles, but on one side only. So what I want you to do is bring one knee over the other, okay? Now, if you've done yoga, we have the tendency of dropping both knees to the opposite side, but what I want you to do in this is drop your knees to the side that the leg is on top. So if this is my left leg right now, I'm going to drop my body to the left side of the room, okay? So you slowly, gently, without letting your hip come off the mat, you're going to drop your legs as far down as possible, okay? Now my hip is coming up a little bit, it's okay, but I'm not going all the way up, okay? I'm trying to manage it, keep it close to the floor as my knees are dropping down. And you don't need to push it. See where you are. Stop right there where it doesn't go down anymore. And first, let's enjoy that stretch, okay? You should be feeling a really nice pull here in the back, going down to the side of the leg, going down to the knee, okay? Now, squeeze your shoulder blades back on the mat. And what I want you to do is take your hand, feel for your lower back muscles, okay? Those are the muscles that are right here. And your core muscles are right here, so palpate them, wake them up a little bit. Now we are going to squeeze all these muscles and slowly bringing our knees to center, okay? So I'm going to squeeze. If I were to use my legs, I could just jump out of this, but I'm not doing that. I'm really trying to squeeze this part of my body. Slowly, gently, it's actually hard work, you guys. Slowly, gently, without using momentum, I'm going to, oh man, that's actually hard, trying to bring both knees to center. Okay, that takes a lot of work, okay? So we'll repeat it one more time. Let me just try it on the other side now. So I'm going to switch my knees, drop both knees, but let gravity drop it down. You don't need to control this part as much. Feel that nice stretch on the other side. So I'm feeling it in my abs, on the lateral side of my abs, and in the front of my hips. Both hands are on the floor. I'm going to squeeze and slowly, gently, without using my leg muscles, without using my ankle muscles, just with the use of my core and back muscles. So I'm doing like a crunch almost. I'm bringing both knees up to center. And for me, my right side's always stronger, so it's so much easier to do this for me on the right side than the left side. And this is where you understand your body. This is where you're like, oh Tammy, you know, I feel it more on this side. It's harder for me on that side. So that's the side you focus more on. Again, with these, you don't need to do 3 sets of 10. You can just try to do 4 or 5 of them, but try to do really good ones, okay? Now, the last exercise we are going to do for this routine is going to be a lower abdomen exercise. So what I want you to do is you're going to take both legs, bring them all the way up. Okay, now push your knees away from your body, point your toes down. And bring your arms up. And we're going to hold it right here. Now this in itself is quite challenging because you are trying to make sure that your back is not going off the mat, okay? Your back is glued to the floor, you're pushing your knees away, pointing your toes down, engaging that core. So try to imagine that you're bringing your sternum, that's where your ribs end, towards your pubic bone, okay? So you squeeze and you hold it there, really squeeze, squeeze, squeeze. So it might look easy if I just hang out here like this, right? But if you're really activating those muscles, you should be feeling it right in your core and in the front of the legs. Now, if you want to make it more challenging, you can just do the same thing, holding it a little bit lower, as long as your lower back is glued to the floor, you guys, okay? You're going to hold this for, start with 10 seconds, then 20 seconds, then work your way up to 30 seconds, maybe even a minute, okay? And then you bring your knees to your chest and give yourself a quick stretch. Okay guys, so that's it in terms of the exercises I want you to start with. There's a lot that we went through at the beginning of this video, and just make sure you take your time with it. I have links into progression of core exercises for you in the description. So once these get easier, I want you to definitely make sure incorporate other core strengthening we have for beginner, intermediate, and then we're gonna move into the advanced ones. But make sure that one video first gets easier. Once those exercises are easier, then you incorporate the next. You can definitely try to do these at least once a day. Your Kegels, again, you want to make sure you hit that 100 number. I know it sounds crazy, but you have to. Practice makes perfect, okay? And have in mind that it takes about 4 to 6 weeks for you to build up muscle. So don't expect that you're doing this for one day and magically you're feeling fantastic, okay? Okay guys, now in terms of who might be having this symptom. This is usually with patients who are younger, who have been involved in sporting activities such as diving, skating, gymnastics. Other sports might be included, but basically the ones that are focusing on really stretching you beyond the normal joint movements. You might also be someone who's never participated in those exercises, but generally you're super flexible. You know, you've been told that you were double jointed. Maybe you can bring your thumb to your wrist, and when you stand up, your knees go all the way back, or your elbows can go a little bit more extended than other people. So you might be prone to this issue in general. You might also be someone who's never done core strengthening and you were involved in a trauma, such as a car accident. Again, I see this a lot with my clients who were in car accidents, who weren't active particularly before the accident. They got into a car accident and then they kind of lost that ability to tell their mind to contract that core. So again, this is divided into categories. You might be someone who have more pain with flexion movements, that's sitting or bending or lifting. You might feel better with extension, that's walking and standing. You might be exactly opposite of that, feel worse with standing and walking, better with sitting. And the third category is the person who has pain at all times. Doesn't matter if you're bending, you're standing, doesn't matter what you do, you have that pain. When you went through video 1, you did the repeated movements, nothing helped you. You're like, Tammy, doesn't matter what movement I do, I still have that pain. And what helps you is that you're sitting and you keep moving. Like you move one side, then you move to the other side to try to find that comfortable position, but you just can't seem to get to that point. Another symptom you might be having is that when you bend forward or when you bend backward, coming back to the center position might be very painful for you. So you might be easily bending forward, but coming up, you have to like grab your back and try to push your body to come up. Or reverse, if you're going backwards, want to come forward, you have that painful arch. It's like there is a certain part of that range of motion of your lumbar spine where you feel like, oh, it's gonna give out right now. That's about it. Just again, I want to focus on the fact that sometimes our lower back pain is not because we have weakness, but because we have a lot of tightness. So make sure that you look at the other videos and before you jump right into this one. And For those of you who fall into this category, I want you to stay away from doing too many stretches for now until you build that strength. Remember, again, your core muscles are sitting right here and they go around your spine like a belt around your spine. So if it's strong, if those muscles are strong, then you have more stability in your lower back, then it won't be aggravated with certain movements, right? I hope you guys enjoyed this video. Again, make sure to check out the links below for progression of core exercises. And once this pain goes away, definitely start stretching and doing functional movements, okay? And as always, if you have any questions, make sure to leave a comment for me. And if you like the video, don't forget to like, share, and give us some love and subscribe to that channel.